Hi.
Hi.
So I'm here today with Mark Ivanitsky, and it's so great to have you back. We did a discussion back in around June last year, and I'm so happy to welcome you to my home in Florida.
Thanks for having me.
And we've just been having some really interesting conversations, mainly this time about female hormone health, but it also actually applies to male hormonal health, which some of the things you were talking to me about I just found really fascinating. And so I thought it would be really helpful to record a conversation with you where you can share some of the things that we were talking about already that might be really of interest to our audiences. So can we just start off by sort of setting the scene and just talking about women? And I love the fact that even though you are a male doctor, you know so much about female hormones. And one of the things that I learned in the past year or so is that even if you haven't hit menopause as a woman yet, you still need to be really thinking about your hormonal health. And I went to a symposium in West Palm Beach where I live, and a lot of very preeminent doctors were talking about women taking supplemental hormones before menopause. And I think that goes against the grain of what a lot of mainstream doctors are talking about. I know when I speak to my doctor, she goes, "Oh, you don't need to do anything, you're not in menopause yet." And I've heard that from many different sources. I'd love to talk to you about your thoughts on this and some of the benefits in actually starting early. Why would you want to maybe start thinking about it in your late 30s, early 40s? Like should you start to be thinking about supplementing hormones?
Yeah, so it's a really important question. You know, when we're talking about hormones with women, we're talking about primarily estrogen and progesterone. And around perimenopause, for most women, the average age around 50, those hormones begin to really decline, kind of drop off really fast. And that's when you start seeing symptoms of perimenopause. You start getting hot flashes, night sweats, irritability. All those issues you think about perimenopause start happening because you have this kind of sharp drop off. And perimenopause actually you do swing a little. You swing up and down, and it's kind of this. Your period starts coming earlier, starts coming later, starts going further apart. And technically, you're hitting menopause when you haven't had a period in 12 months. That's when you're officially now in menopause. You no longer have had any periods, and so that time frame can last between, within a few years of onset of perimenopausal symptoms. The issue is that estrogen and progesterone are super important female hormones. They're very important for brain health, for cardiovascular health, for bone health. It is essential that women have high levels of estrogen in their bodies for as long as they can. The idea now is the thinking in functional medicine is we want to make sure women are having estrogen in their body as long as possible. So, depending on when you started menstruating, some women start really early, some women start really late. You have this window of high estrogen, and it's really important to kind of keep that window as long as possible. And we're finding now with studies is that women who, starting in perimenopause and into menopause, start supplementing with estrogen, so giving bioidentical estrogen to the body, getting estrogen levels into a maintenance phase that they're not dropping and they're in this higher, healthier kind of zone, is able to maintain those benefits for longer. So you're able to have stronger bones, have a healthier heart, have a healthier brain as you age. And so the idea is that, it's safe. There have been a lot of studies now in women who have been taking estrogen for many years, and we're finding that there's that if it's done properly, it can be very, very safe. The issue to think about with estrogen, is with anything, there's always a downside. Is too much estrogen dominance, having too much estrogen, can potentially be a negative in that estrogen is causes cells to grow. So cells to grow in the breasts, cells to grow in the uterus. It's cell proliferative. We say it proliferates cells, and so we want to be careful with estrogen because it can be responsible for cancers, because that's what cancer is. It's too many cells growing too fast, and estrogen kind of pushes that. There are ways to mitigate that, ways to support that sort of estrogen dominance. For me, one of the ways that I love doing that from a European biological medicine perspective, is supporting the liver. The liver is one of the most important detox organs of the body. It helps to filter and helps to metabolize estrogen in the body so that we're able to get it out of our body safely. And so for a lot of reasons, detoxification, we can talk about it, is really a foundational first step, in my opinion, before starting hormones, because we want to make sure that the organs responsible for clearing estrogen, not only estrogen, but clearing endocrine disruptors, toxic chemicals in our environment that are disrupting the normal estrogen processes and metabolism in the body. These are things found in kind of the most common things women are using all the time: skincare, cosmetics, plastics in our food. These are all, we call them endocrine disruptors. They mimic estrogen, and they can create this disruption of normal estrogen metabolism. So having a functional, really healthy detox system in the body is so critical for that. So I always like to say, if you're going to be doing estrogen, it's really important to make sure that the body is able to do that. And through European biological medicine, we use drainage remedies, which we've worked with together on. These are remedies that help support those main organs of elimination: the liver, the kidney, lymphatic system, the gut. These are the organs responsible for processing and eliminating toxins in the body, but then also to helping to maintain a good balance of estrogen in the body.
So you actually sort of said a lot there. I just wanted to just do a quick sort of summary. So I think something really important. So if you're in your late 30s, early 40s, just be aware that as you reach perimenopause, your hormone levels are going to be going down. And I think, Mark, you mentioned some of the impacts of that. So like hot flashes, maybe anxiety is one actually that isn't talked about a lot. Increase in anxiety. I think I've definitely felt that as I've been aging. Also brain fog though, and I don't think that's talked about enough. That can also be a symptom of dropping hormones. Losing elasticity in the skin. Mm-hmm. You mentioned bone health. There's so many things that estrogen actually helps to protect a lot of key functions in the body, as well as proliferating cells, as you mentioned. Mm-hmm. But what's so vital, as Dr. Mark just mentioned, if you are supplementing with a hormone, you do need to make sure that your detox pathways, including your liver, is able to flush out any excess estrogen. And would you also encourage people to be monitoring their estrogen and progesterone levels if they are taking supplemental hormones? Because I know there was a lot of discussion, maybe, 20 years ago, about cancer risks of taking estrogen. Do you want to just talk a bit about that? Because maybe some people are thinking, look, yes, I do want to have estrogen. I know that it has a lot of protective benefits. I know that it can help for my brain. It can help, I've heard it can actually help prevent things like Alzheimer's and dementia and things like that. It can help,
it's neuroprotective. It helps protect the brain and the nervous system.
And protect bone health as well, mm-hmm. against osteoporosis. And these things might be, potentially risks in your family. So they might want to do it, but they might be scared about breast cancer. Mm-hmm. So do you want to just talk a little bit about that and what they should be thinking about before making a decision to supplement?
Yeah, so like I mentioned, I think making sure that that detox is a priority. I think supporting detox and having that be front of mind in terms of making sure that the body is able to eliminate excess estrogen properly. Things like DIM, for example, like kind of big heavy hitters, when we talk about DIM or glutathione, these are big molecules that are making sure that the liver is functioning properly. And some people are very sensitive to those types of things, which is why I always recommend using drainage remedies, because they're really great for sensitive individuals. And
you can buy those on Amazon, or is there better places? Like DIMS, it's just a tablet that you take that I think helps take out any excess estrogen, right? It's made from broccoli or cruciferous vegetables?
From cruciferous vegetables, yeah. So it helps basically support the key metabolic detox processes in the liver that are processing estrogen out of the body. So it's a kind of a really kind of granular way of kind of getting specifically estrogen out of the body.
And can I just say, that might be really important, because other than your estrogen levels going down, the other thing that's happening is you're actually getting these big fluctuations as you go down. So when you have an estrogen spike, which often happens, and that's when you get like the hot flushes.
Yeah.
If you are supplementing with hormones.
So I actually wouldn't recommend supplementing with estrogen until you're within perimenopausal range. I don't think it's a great idea for example, you mentioned your 30s. In your 40s, if you're a healthy woman who's menstruating, I don't think it's a great idea to start estrogen at those years. I think focusing on detox and supporting the body naturally. I think there are some really great. Progesterone is a different kind of altogether. Progesterone is safer. So estrogen and progesterone kind of work on as this kind of balance. So estrogen potentially has these negative effects. There really are no negative effects to progesterone, and progesterone balances out estrogen. So any negative, so you would never want to take estrogen by itself. That's a key kind of hormone supplementation rule that we want to make sure that if you're going to be using estrogen, you always want to make sure progesterone's in the mix. And sometimes some practitioners just give progesterone because it's safe and they don't want to have to deal with potentially the issues. One of the issues, cancer risk is definitely an issue, but one of the issues is increased bleeding. And if you're still bleeding and you're still menstruating in that perimenopausal phase and you're given excess estrogen, it can cause more bleeding. So the way that it works in the uterus is estrogen helps proliferate cells. It's making more cells in the uterine lining. And so we get a buildup of blood and cells in the uterine lining because we're waiting for a fertilized egg to come in. It's kind of like a nest. You think of the estrogens building this nest of cells that's going to be available for the fertilized egg to land on. Progesterone is kind of like the mortar in the nest, or mortar in the bricks of those cells. It's keeping it stable. And so progesterone keeps the lining stable. When the egg drops, boom, we've got a healthy attachment that happens in the wall of the uterus, and then there's a spike in progesterone because the body says, oh, now we really need to make this stick. And so women who have issues with progesterone actually around trying to get pregnant, the issue is that there's not this sticking effect. There's low levels of progesterone, and then things like miscarriages and things unfortunately can happen when there's not enough progesterone in the body to keep that stickiness there. But progesterone has a lot of benefits in that, again, it balances out some of the negatives of too much estrogen in the body. Progesterone by itself is also really helpful for sleep, for mental emotional stability, for brain health. So progesterone is kind of like the really great supportive supplement that needs to always be in the mix if you're going to be supplementing with hormones.
Okay. And so I just want to just kind of circle back to one thing that you said. So you said that people probably shouldn't supplement with hormones in their 30s or 40s.
Well, it's, as a general,
How do you work out when to do it? Because one of my friends actually started menopause in her late 30s.
Right.
She had a lot of depression from that, of like starting early. And I think there's a whole kind of range. I'm like rather late, I think. I haven't started menopause yet, but I feel like in terms of my cycle,
I think it's a case by case basis for sure. But my point is that generally you don't want to start with too far before too early. There's the risk there with.
So what are the signs people should be thinking about?
The number one sign would be your period, and if you're noticing shorter periods or longer periods and more inconsistencies in the length and duration of your periods, that's a good sign that estrogen is kind of going offline for some reason. And for the majority of women, it's perimenopause that's causing that. It's the drop that's happening naturally in the production in the sex organs, in the ovaries. So that's probably the telltale sign. And then in perimenopause, also this drop in estrogen creates all those perimenopausal symptoms: hot flashes, night sweats.
So you should wait until you're getting some symptoms, you're getting some irregularity in your periods.
Ideally, yeah, because it's a very powerful hormone and it has some really great benefits like we talked about, but there is that risk, and you want to be careful, and a lot of practitioners want to stay away from that risk altogether, and they say don't take any estrogen, just do the progesterone. And some women have benefit, or they see symptom relief with just progesterone, and I've seen that too. Women who are in the perimenopausal phase, are getting irregular periods, are starting to see some of those symptoms. Just supplementing with progesterone can mitigate a lot of those symptoms. It's fairly common. But again, like we mentioned, there's all the studies on information saying that the longer you can keep estrogen specifically in the body is really key for sexual health, also for libido, for bone health, for heart health, for brain health. It's really powerful. So many benefits for women. to keep estrogen high as long as possible.
So another hack, actually, and this is just something that I recently learned. So I signed up for a online service called Function Health, and I'm going to put like a referral code below. I'm not saying this in order to promote it because of the referral code, but I've had so much benefit from Function Health, and one of the things that was a real breakthrough for me is you get tested for over 100 different biomarkers twice a year. And one of the blood draws, they ask you to have the blood draw on the second day of your cycle. And I have never been asked to do a blood draw on any day of my cycle. The doctors just say, okay, we'll just do it now. And it's just been kind of like haphazard. The benefit of doing it on the second day of your cycle is you've got now a measuring point of what your estrogen is. So your estrogen levels will fluctuate up and down during your cycle. And so if you're not knowing where you are in your cycle and you're getting numbers, you're measuring estrogen, it's pointless. You don't understand where you are. But what you can see if you're measuring on the second day is you can see what the range should be and where you are in the range. So I could see from that, okay, I haven't hit menopause, I'm in perimenopause, and my levels are actually very low. So I might be a suitable candidate to be starting, obviously in consultation with my doctor or a medical professional like yourself. And I think that that's something really empowers women to actually start looking at that. Previously, all my doctors were looking at is, are you in menopause? And is it your FSH, where your FSH is?
So the FSH is the hormone the brain produces basically to tell the follicles, it's follicle stimulating hormone.
Yeah.
It starts telling the ovaries make a follicle. And if you have follicles, every month you're making a new one. When you get to a point where you have no more follicles, that's menopause, perimenopause, the brain starts secreting FSH, make follicles, make follicles, make follicles. And the ovaries like, well, you don't have any more follicles, we can't make follicles. The brain starts screaming at the ovaries, make follicles, and then those numbers go up. So FSH goes really, really high, and that's a signal that the brain is talking, make follicles, and the ovaries aren't able to. So that's the most telltale sign that you are now officially in menopause. Other than
have
like
high FSH, right?
High FSH, because
that's what most of the doctors seem to be tracking, but they don't seem to be looking at where your hormone levels are. So I would just say, if you want more empowerment in terms of what's going on in your body, consider something like Function Health, where you can do this monitoring to just understand what's going on behind the scenes. I think that can also be a good way to track to see. You were really helpful to me because when I was talking to my doctor about supplementing, and they were like, oh, you don't need it, wait until menopause. And I had heard preeminent doctors at the symposium saying completely the opposite, and that, especially things like dementia, Alzheimer's, that if you get a handle on estrogen now, it can be a massive difference. And if you wait until menopause, it might be too late. You were helpful in kind of explaining to me, I knew estrogen, but I didn't know that there were actually 3 types of estrogen. And I had read in a book that you want to try to go with bioidentical rather than synthetic, that can cause problems. But could you just maybe go through the 3 types of estrogen and why they're important? Because that might also really help empower some people that are watching this to understand a bit more about their bodies as well.
Yeah. So we've got E1, estrone, E2, estradiol, and E3, estriol. So estradiol is the main estrogen. That's the one that you're going to have in your body as having all the benefits and having you have the longest in your body. Estriol.
And diol, because it's like
diol 2, estriol 3.
And estrone with like 1, it's got 1, so that's how you can remember.
So when you're young and you're menstruating, estradiol is kind of the predominant hormone. That's really what we talk about when we talk about keeping estrogen levels high, is estradiol. Estrone is what you kind of your body shifts more to E1 when you're in menopause, kind of keep a baseline level of estrogen. Estriol is what your body produces when you have when you're pregnant. So all of them have the benefits of estrogen. Estradiol is really the heavy hitter. That's the one you think of when you're thinking about supplementing bioidentical hormones. You want to do estradiol. There are benefits from just doing estriol too. So usually practitioners will recommend estriol topically in the vagina because it's safe. It doesn't cause proliferation of cells, but it can help with vaginal dryness, So a lot of creams will have estriol in it to help with vaginal dryness as a primary symptom. There's a cream called Bi-Est, which uses a combination of E2, E3, which I love, and I think is a really great way to help support, because you're getting the benefits of estradiol in the Bi-Est cream, then the estriol gives an added benefit without giving too much estradiol. If you give estradiol by itself.
The estriol, the third one, I know that's when you're pregnant, your body produces a lot of that. Is that, even though you're going into, you're in perimenopause and you're approaching menopause, it doesn't like make your body feel like it's being tricked by putting like the third one in, E3?
No, typically not. Typically your body handles it really well, and it has mostly just benefits. No real negative side effects to estriol use.
Okay.
And again, help with more like sexual health and sexual functioning in the vagina, more targeted than a kind of systemic effects, but also, not really any much negative effects with that one.
And so I think you're hitting on a really important point, because, and it's just a minefield, I think, for women who are at such a busy moment of their life, often still got kids in the home, maybe parents who are aging, and full-time jobs, and now their hormones are kind of declining, and it's just trying to understand about this can be a lot. There's then a decision about what kind of hormone supplements you take. Do you take a patch? You mentioned something you can take vaginally, and then you mentioned, I think, a cream was the one that you liked. What would you recommend women do to decide? I think there's also a coil actually too. How do you make a decision about what's going to be best for you? And where do you get these things from, especially if your doctor is saying you don't need to get anything until menopause? What do you do?
Yeah, I mean, ideally you're having this conversation with your doctor and you're working out a plan. Depending on comfort levels, personal choice, there are different forms that you could be taking. When I was working in a clinic in California, we did a lot of patches. And patches you do just twice a week. And you can you do them on your abdomen. They're a great way to slowly let in estrogen levels. Now there's a company I love called Quicksilver that I work with. Quicksilver produces liposomal forms of estrogen. So liposomes basically are giant, or not giant, they're small little fat balls that you can put things in. And so the fat ball is great as a delivery system because your body recognizes it really, really well. It just absorbs it really, really fast. So absorption is really great with these. And because of that, you can do much lower levels and have a really beneficial effect. So because of liposomal forms being so potent, you can use much less and have a really great effect. So I love liposomal forms pretty much of all nutrients and supplements and hormones. In particular with women going through menopause, I think it's a really great form to do. And it's topical, so you do a pump. You can do it on the soft skin of the body, so like forearm or inner thigh, and gets absorbed really, really fast. And it goes into the blood and is able to have those benefits. So I personally now have kind of evolved to really like Quicksilver liposomal forms.
Yeah.
But again, there are many forms, and working with your doctor, you can get some covered potentially by insurance. Depending on your state, you can get the patches, the different creams. For progesterone, very common to use oral. You don't want to use oral, and really you can't really get oral forms of estrogen because it's going to be metabolized by the liver very, very fast and can create a lot of strain on the liver. So we never really give estrogen in oral form for women. Progesterone typically can be used orally and is used orally and can be really helpful, primarily for sleep or for women who are having issues with carrying with pregnancies. Progesterone can be really great orally, but cream as well. There's some really great creams on the market, and Quicksilver makes liposomal progesterone cream. So
can people buy that themselves, or will their doctors be able to prescribe that?
So with the liposomal forms of Quicksilver, you can get them on Fullscript, and Fullscript is kind of my preferred online supplement dispensary. Technically, you can only get them through a doctor if you're going to be getting them, but there are a lot of doctors, myself included, who will just allow people to purchase on their own supplements. So there are Quicksilver in particular goes through Fullscript. There are some companies that make liposomal forms of progesterone, for example, which or not liposomal forms, just progesterone creams, which you can get online. You can get on Amazon. You can get on different sources. So it's possible to get these over the counter. I would just be careful. I would work with someone who has a little bit of knowledge, because again, there are some risks, especially with taking estrogen. Having too much estrogen or having too high levels of estrogen, especially if you're still menstruating, producing estrogen, can create some issues. Again, with bleeding being kind of the biggest one, which I've seen be pretty common with women who start estrogen replacement. And the other is cancer risk, and that is a theoretical risk. It's also, I worked with a lot of women who've been on it for a long time and never got breast cancer or uterine cancer, and some women who have. There are some doctors who I've worked with in the past who say that, that risk is really minimal. It's really just kind of blown out of proportion by fear-mongering practitioners who don't want to deal with hormones.
Well, I did have one member of the audience who was a doctor from the UK in that symposium that I was part of. And she said that she strongly believes that anyone that is predisposed to getting cancer will get cancer no matter what, whether you're supplementing or not.
Yeah.
And I think the other doctors were like, that's quite a strong view. But I thought that was interesting.
Yeah.
But I think, what's interesting is I'm actually just started on the Quicksilver biased that you can get on Full Script. And I have to say, I'm feeling like a lot less anxiety. I'm feeling like a lot more relaxed, a lot more clear-headed. I'm just using a really small amount. And then what I'm going to be doing is to check my estrogen levels regularly with Function Health and make sure that they're not spiking too much. I'm going to be taking my blood draw on the second day of the month and just compare. And if I'm getting up beyond the range I should be at, obviously I'm going to be reducing my dose down.
Yeah.
But yeah, I think it's really important to stress that it is important to continuously check your blood levels and where you are.
One thing I want to talk about, which we didn't mention, is the adrenal health.
Oh, great.
So the adrenal glands are really important producers of estrogen and progesterone in women, especially as women age. So as you go through menopause, the adrenal glands begin to take over more and more production. So less production is happening in the ovaries, and more production is happening in the adrenal glands. And some studies say up to 60% of estrogen progesterone production is happening in the adrenal glands in women. So adrenal health, adrenal fatigue is a really big topic and concern for busy women who are stressed and running around and have multiple things going on. The adrenal glands can become stressed, we say. They're not producing as efficiently anymore just because of stress. And because of that, then they're also not producing enough progesterone and estrogen. So really supporting the production of estrogen and progesterone through the adrenal glands, I think, is really important. Using adrenal adaptogens, minerals, vitamins that are helpful for the adrenal glands, and adrenal glandulars can be really, really key at supporting the adrenal glands as well. In the same way you would take a glandular to support the thyroid, you could take a glandular to support the adrenal glands, which I've used and really successfully with patients. So having an idea, just so in the beginning we talked about having your thoughts around detox and detoxification, having thoughts around adrenal health is really important for...
Would you mind putting in the show notes just some adrenal supplements that people can maybe consider purchasing on Amazon?
I mean, some really great ones people probably have heard of: ashwagandha, rhodiola, Siberian ginseng.
Okay.
The traditional adrenal adaptogens are really great at supporting adrenal health and supporting the health of the adrenal glands. Adrenal glandulars is a product called cytozyme AD, which is bovine adrenal. That's really helpful.
I've had that, yeah.
So...
And just to clarify, I think it's really important, I was mentioning before, women in their sort of midlife, it's one of the most stressful times because, if you've got kids and you've got aging parents and you're at a time of your career where you're often like a manager and there's just so much stuff going on, it's easy to get adrenal fatigue. And your adrenals are what is producing your stress hormones. And you need them, and you need them to be producing other hormones as well.
Yeah.
And so I think you mentioned before about making sure you're detoxing your body. Thinking about adrenal health is also really important.
Yep.
And a lot of women are going to be like, "Oh, this is just so much. Like, I've already got so much to do. This is so much." This is such a key time in your life to take stock. In your 20s and 30s, you were probably running around drinking, carefree, and probably putting a lot of toxic load on your body. It's now a time of reckoning to clean up before you move into the next stage of your life.
Yep.
And I think just taking that time to really spend time cleaning up, cleaning house, before you move into menopause.
Yeah.
It's so worth the effort, because you're going to make sure that you are set up for a healthful next stage.
Yeah.
So I can't stress that enough, and I just wanted to just really kind of reinforce the point that you were just saying.
Yeah. Yeah. It's really critical. It's really key to think about that, and and make yourself a priority, especially as you go through that. A lot of women have been made. The stereotype of the superwoman, the supermom who cares about everyone but herself,
Yes.
takes care of the kids, the husband, the family,
Yes.
but really needs to focus on herself, and really self-care and thinking about supporting her health and her body as she moves into the next stage is really, really key for women.
One thing I want to just leave on is a story. I caught up with a friend of mine, and she was talking about how during perimenopause, you lose your ability to tolerate bullshit, and which is probably a good thing, right? Because she would just sort of say, she would snap at people, and she had less. I think people were just kind of like, her husband was like, "What's going on? Like, normally she'd do all of this stuff for me, and now she's like pushing back." But I think this is really your invitation to push back, and to really make your health your number one priority. And to do it in a loving way, and to maybe explain to your family what's happening in terms of your body health, and ask for their support. But yeah, it just thought it was interesting that she was kind of like saying, like, I feel so much more empowered. I've got a short fuse now, but I say what I want. And so it's a key moment for her in terms of owning her voice.
Right.
Well, listen, on that story, I think we can close. It's been such a pleasure having you.
Yeah,
Thank you so much for the conversation, and hopefully you guys have got some value out of it. I'd love to hear in the comments below what landed for you, what were your key takeaways, and are there any things that you would like to share with other people that you found helpful? Thank you.